1. Roll up sleeves if any, and remove any watch or jewelry that might be on the way. Open faucet to lukewarm water. Wet hands thoroughly, do not shake them. Apply enough soap to create lather. Make sure to lather for at least 15 seconds. After creating enough lather in the palms, interlace fingers and wash in between. With one hand, grasp the opposite wrist and clean it in a circular motion 3 times. Repeat procedure to the other wrist. With one hand, grasp each finger and clean them in a circular motion 3 times. Repeat procedure to the other hand. Do not forget the thumb. Make sure to lather the front of the hands. In the palm of the opposite hand, take your nails and use the palm to clean underneath them. Repeat procedure to the other set of nails. Rinse both hands thoroughly. Remember, do not shake them. With one hand, get a clean paper towel and rinse from the tips of your fingers to the wrist. Turn the hand around and repeat procedure. Make sure to always get a clean paper towel every time. Dispose of the paper towels as they're used. Repeat procedure to the other hand. After hands are dry, get another paper towel and turn the faucet off. There are 3 important things to first ask the patient when trying to figure out if dealing with an imminent delivery. Number 1. Have you had an abnormal discharge from your vaginal area, like a large source of water or something in that nature? Number 2. Do you feel an urge to push or that you need to have a bowel movement? Number 3. I need to check to see if the baby's head is starting to crown. Can I expose your lower abdominal area and your peritoneal area and take a look? When doing this move the patient to a present and quiet spot. Let the patient know you're going to be exposing them. If the baby is crowning, the baby's head will start to present through the mother's vaginal opening. If the answer to any of these questions is yes, then you know an imminent delivery needs to be done. Protect the patient's privacy as much as possible. After determining you're dealing with an imminent delivery, ask the patient a few more questions. Number 1. How many previous pregnancies have you had? Number 2. How many live births have you had? Number 3. Have you had good prenatal care? Number 4. Are there any expected complications with this pregnancy? Number 5. Are you taking any medicines or do you have any allergies to medication? Number 6. Do you have diabetes, high blood pressure, or anything of that nature? After asking these questions, it is time to prepare the mother for delivery. Explain to the mother what is going on and what you're going to do. It is very important to keep the mother in control and have her do what you need. It will make the delivery safer. It is important to wear protective equipment, wear gloves at all times, and wear a gown if available. Reposition the patient for better precision of delivery. Move the mother down so that her buttocks rest on the edge above the surface she's on. Hang the mother's leg off the side. This position is called the seeker method. Ideally, I would drape sterile dressings over the mother's leg, but a good substitute is towels. Because crowning is present, apply gentle pressure on the baby's head to prevent an explosive delivery. Make sure not to push directly over the fontanelle area of the baby's head. Instruct the mother to take a deep breath and push for 10 seconds. Try to get about 3 good 10-second pushes with every contraction. When the baby's head is out, slide hands around the neck area. Check to see if the cord is wrapped around the baby's neck. If cord is wrapped around the baby's neck, tell mother to stop pushing and take deep breaths. Slowly, with your fingers, try to unwrap the cord without tearing it. If this can be done, transport the mother and the baby as soon as possible to your nearest hospital. Now that the head is out and the body is starting to turn, support the head and the neck. Suction the baby's mouth and nose. Always suction mouth first and then the nose. As another contraction comes, deliver the anterior shoulder first. Support the baby and apply slight downward pressure so that the anterior or right shoulder delivers first. Apply slight upward pressure and deliver the posterior or left shoulder second. After the shoulders are delivered, now it is time to clamp. Place the first clamp 10 centimeters away from the baby and close it. Place the second clamp about 5 centimeters away from the first. Cut the cord in between clamps 10 to 15 minutes after birth. Take a towel and remove baby from the mother's abdominal area. Warm and dry the baby. Suction the baby's mouth and nose again. Finally, wrap the baby and give mother to breastfeed.